Welcome to the Expert Series brought to you by the Lupus Foundation of America. Our health education team is here to bring you experts in lupus to discuss topics to help you live better. Thank you for tuning in to today's episode. My name is Lauren and I'll be your host. This month is Men's Health Month, and we are talking about men's health and special considerations with lupus. And to answer some of our most asked questions, we welcome Dr. Timothy Niewold. Dr. Niewold is the Judith and Stewart Colton Professor of Medicine and Pathology at New York University Grossman School of Medicine. He also serves as the director of the Colton Center for Autoimmunity. And Dr. Niewold is a physician scientist working as a human geneticist and translational researcher. His lab focuses on identifying and understanding the cause of autoimmune disease and how genetic risk factors impact the immune response. His work has contributed to the underlying genetic basis of lupus and the role of type 1 interferon in triggering the disease. He also serves on the Foundation's Medical Scientific Advisory Council. Thank you, Dr. Niewold, for joining us today.
Great. Thanks for having me.
So it's June, it's Men's Health Month, and what I really want to talk about is men's health. So we know about 10% of the cases of lupus occur in men. So mostly it's women, but about 10% do occur in men. So I'm hoping you can start us off today and help us to understand a little bit more about two things. One, why is it much less common in men than it is in women? And two, since it is less common, do you approach diagnosing a male patient any differently than you would a female patient?
Okay, great. So that is correct that it's only about 10% of lupus patients that are men and 90% women. So as far as that first question about why is that, I'll say that's still one of the larger mysteries we have in lupus. And I think a lot of us have thought, once we understand that, we'll understand a lot more about lupus. So the simple answer is we really don't know for sure. We have wondered about genetic factors, and there are some interesting studies suggesting that, for example, people who have Klinefelter syndrome, which is where you have two X chromosomes and a Y chromosome. So normally women will have two X chromosomes and men will have an X and a Y. There are some genetic syndromes where you get sort of an extra X chromosome. And it's been shown that in some of those cases, actually, lupus is as common in women. So if you're XXY, the rate of lupus is similar to an XX female person. So it's interesting, but it's clearly not all X chromosome. I'll say that I work in genetics, and we've tried to find risk factors on the X chromosome, and we found a couple, but nothing that can explain this sort of larger mystery about why women get lupus more often than men. So that's definitely true. But as you said, men definitely do get lupus, and 10% is not a trivial number. There are a lot of men with lupus out there. So I think that brings me into the second question that you had about diagnosing men with lupus. I think the first thing that I think of is that people are less likely to think of it, and that can sometimes delay diagnosis. And by people, I mean both patients and physicians, I think, are maybe a little less prone to think of lupus when a man starts becoming sick with some of these symptoms than they would if it was a female patient. And so I think it's just important, that we keep our eyes open and catch, these cases as early as we can. I'll say that I've seen sometimes people be diagnosed with rheumatoid arthritis or be diagnosed with maybe ITP, for having low platelets. These are conditions that have a closer to equal male to female ratio to them. But then as you kind of dig in deeper, you realize it's actually lupus. And so, at least in those cases, those are conditions that we see in rheumatology, and so they might be headed to a rheumatologist anyway. But I worry that there may be more diagnostic delay in general in men who have lupus. And I'll say that as a field in lupus in general, we worry about diagnostic delay already. I think for women also, there's a risk of diagnostic delay because lupus can present in some mysterious ways. And I think that that's something that many people have gone through on their own journey.
Yeah, you said that you're absolutely right. That 10% is not a trivial number. And I think that's something that sometimes gets, the amount of men does get overshadowed by women, but I can definitely see how that can be an obstacle to getting a direct diagnosis. So if a patient comes into your office and has, a male comes in and he has symptoms, He's obviously at a rheumatologist's office because someone has, sent him there, or he has cause to believe he's got a lupus or a rheumatological condition. But do you ask a certain set of questions or do any exam that's a little bit different for men than you would for women?
I'll say a lot of it is really similar, honestly. So I think that's why I gravitated to this. Just thinking of it as being one of the more important things. I think the laboratory evaluation is the same basically. So we'd run the same sets of autoantibodies and blood markers that we would do, whether it's a man or a woman. I'll say that in some ways the more likely presentations can be different, but at the same time, lupus is different in everybody. That's one of the things I think we get used to taking care of lupus patients, is that really there are a lot of differences between people and which symptoms they have, which organs are involved, and so I think that's kind of the set point as a rheumatologist taking care of lupus patients, and it does contribute to, I think, some of the difficulty in diagnosing and in getting to that step from primary care or first intake to a rheumatologist. But the workup for the condition is really similar, and then we usually would focus in on areas that are involved. If there are physical symptoms, we of course would zoom in on those, and then we always screen the kidneys because we always worry about kidney involvement in lupus, and that can occur without physical symptoms. So you can have kidney involvement without necessarily feeling it. It doesn't give a person pain, and so we are always on the watch for that in both men and women.
Is there a difference in the rate of kidney involvement for men versus women, or is it about the same for men?
It might be more common in men. I'll say that in general, the symptoms and presentation of lupus can be more severe in men than in women. And we think that's probably telling us something about disease. We don't really understand why, but it's interesting that men get it less often, but if they do get lupus, it's probably on average a little bit more severe. I think we're still sorting through this, so I think, some explanations could come even from some of the issues I mentioned already around diagnosis, so if we are more likely to miss a diagnosis of mild lupus in a man, then maybe that could be part of it. I think we've gotten better, though, at catching lupus cases in general, and yet this difference seems to persist. So I think there may be something biological and not just our own sort of biases and diagnosis leading to this, that there may be a difference. I'll say that it seems a little more common to get serositis in men also, so that's something I've noticed in my own practice, is that this is inflammation around the lungs or inflammation around the heart. Seems a little bit more common in men with lupus as well. And this general disease severity seems to be true in cohort studies as well, that if you use some of the measurements like the SLEDAI disease activity index that we use in clinical trials and just sort of examine your group, you can have higher scores, meaning more active disease in men or more severe disease.
Wow. Okay. Gotcha. That's really interesting. So some symptoms, like you mentioned with the serositis, may be more common in men. What about alopecia? This is the hair loss, and it can occur both in men and in women with or without lupus. It definitely happens in folks with lupus who have skin rashes with lupus and hair loss. For those listening in, does this alopecia related to lupus look any different than, say, male pattern hair loss that is typical for men over a certain age?
Yes. So this, in most cases, it's a pretty clear difference. And the reason I say in most cases is that lupus can affect the hair in a number of different ways. One of the ways that you can get hair loss in lupus is if you have the discoid rash, which many people listening may be familiar with this. It's sort of usually a raised, hyperpigmented or red rash, and unfortunately, the discoid rash is one of the scarring rashes that occurs in lupus. Some of the other rashes are non-scarring, which is obviously better. None of the rashes are pleasant, but the scarring feature of discoid is a really troubling part of it. So if it happens on the scalp, it can cause scarring such that the hair won't regrow afterwards. So this is one type of hair loss in lupus that, when that occurs, is typically patchy. It doesn't follow any specific anatomic lines. I'll say that in contrast, male pattern baldness, we're all, kind of familiar with the pattern. The pattern is part of the name, and so we know it usually happens in the, the kind of upper frontal areas, top of the head, usually then preserving the sides and lower back of the head for the later, until much later stages. And male pattern baldness also tends to be, gradually progressive, and so that's, that's as if, for any listeners who have it, or if you have relatives who have it, most of us know someone who has that, and you kind of know the course of that. And if you look back through pictures or think of, over time, it's sort of gradually progressive, over years. And so that's usually fairly easily sorted out. There are, there's lupus hair, which is kind of a brittle fragility of the hairs, often occurs in the frontal area. That description, is kind of different than male pattern baldness, whereas male pattern, there's a gradual thinning, and this this brittleness isn't so much a part of that. But that's one where there's might be a little bit more confusion or overlap. I think discoid and male pattern aren't two that are likely to get confused. And then there is an increased rate of alopecia areata type hair loss in lupus as well, which is thought to be an autoimmune type of hair loss. And that also tends to be patchy and often fairly dramatic, where you can get a pretty full loss of hair. Again, with male pattern baldness, usually there's a thinning that occurs that precedes full baldness, and it's a more gradual process, whereas some of the inflammatory types like alopecia areata can occur fairly quickly. And that's, I think, true of other autoimmune types of hair loss. So most of the time you can tell the difference. There are maybe some cases that could hit the gray area, but I would say most of the time you can diagnose the type of alopecia in a person with lupus.
Gotcha. Well, that's really helpful to have those kind of laid out. And I know that we have people who will contact the health education specialist. They want to know about, the hair loss and if there's anything that can be done, because there are so many products out there for male pattern baldness or to slow that hair loss. Is there anything specific that you recommend to people who have lupus-related hair loss? Are there any treatments that you know of that are effective?
Yeah, so definitely this is something to see your rheumatologist, or if you have a dermatologist participating in your care, it's important to get seen for this, because there are things that can be done. So the inflammatory types of hair loss, we'll often use some of the same types of immune system medications that we would use, and particularly if it's an isolated scalp involvement, you can sometimes do steroid injections, for that, and then it's a more localized treatment. If there are other parts of your lupus that are acting up at the same time, then you may sort of get an overall, immune modulation treatment, like either pill corticosteroids, or, we don't like to use pill corticosteroids when we don't have to, but we still use them sometimes, or an adjustment in some of your other immunosuppressive medications, or hydroxychloroquine if you're not already taking it. So it's definitely something to bring up, because the immune-mediated types, if it's discoid, like I mentioned, the scarring process, you do want to get on top of it. It may be that some has already, by the time you seek care, it may be that it's gotten started, but you don't want to let it go for too long. You'd like to get on top of it as fast as you can and seek care. So, and same for the other inflammatory types, because the non-scarring types then typically will be more reversible, and it's just really an unpleasant thing to have happen with your lupus. There are many unpleasant things, and that's definitely one of them. So yeah, see your doctor if you have hair loss, especially this kind of something where you're worried that it may not be male pattern. Get in and get seen.
Yeah, that's a good point. So like any kind of escalation in symptoms that are noticeable, whether it's hair loss or other inflammation in the body, it's a really good time to follow up with your rheumatologist and say, okay, let's see what's going on with, your medications, and see how your lupus is doing, right?
Yeah. In general, lupus is unpredictable, and so we always try to get people in when something's going on, or at least want to hear from you, so that we can know what's happening. I think as we try to get more effective management for lupus, and hopefully better medications and all of that, we hope that we can make life more predictable. But things can happen, and so definitely it's really good. Just general lupus advice is don't be shy. When you're worried about things going wrong, reach out, lupus in, because then we can help.
That's right. And, and I think it's so often really hard to make that step and actually say, I need help. But it's the best way to get the help that you need, especially with a trusted physician. And okay, well, let's talk a little bit about treatments for men. And specifically, if there are some treatments that you know of that are good for lupus that seem to work better in men versus women, and if there are any kind of special considerations for some of the medications that are used. I know there might be some that can cause some infertility. Is that true? And what do you kind of consider when making these treatment plans?
Yeah. So as far as which treatments, we haven't got a lot of specialization about, like some treatments working better in men or women, I'll say, at least with what we've currently been using. Okay. But the second part of the question, this is a consideration, is that in particular cyclophosphamide, which is one of the treatments we use, we consider it kind of one of our big gun type therapies, So if you have a serious manifestation of lupus, one of the classical things would be if you have acute severe kidney inflammation, one of these things that we're always checking for and worrying about. If that's happening, cyclophosphamide would be one of the medications that would be considered. It's not the only choice, but it's one of the things that we use in that setting. And it has been shown to decrease sperm count and to impact fertility. It happens in both men and women. I'll say that in women, it's probably even a little bit bigger consideration, and that it seems like men can probably get away on average and a little bit better, but we still have that talk with men who are going to receive cyclophosphamide about reproductive planning. And there are options like banking sperm and other things that you can do if you're going to undergo a course of treatment. And there's time. We make these decisions over days typically, so it's not like, you have to come into the ER and you get it before anything can be done. It's serious, but at the same time, it's the choice about cyclophosphamide is usually made after someone's brought into the hospital, and usually we use some corticosteroids that'll work right away, and then we sort of think about it. So there's a period of time where we can have this discussion, and of course, that's very individual, and it depends on people's individual plans and concerns. But there are options, and it's good to know about that before cyclophosphamide.
Yeah, absolutely. Well, thanks for shedding some light on that. I think it's great to know that there's a little bit of time, and this is, like you said, the big guns medicine. Whenever you really have active lupus and in the kidney involvement, where you need to get something in there to take down that inflammation. So when we're talking with men or men that call in to the health education specialist, we often hear that it can be really difficult with lupus because it's so unpredictable and because the fatigue and the pain can be debilitating. Traditionally men are the ones that have been for many years working outside the house and bringing in the largest income, but now we're not as much, but still rings true for a lot of folks out there. And so we do have people contact us and they ask us about work with lupus and if there are workplace accommodations or considering the kind of work that they do. Do you get these kinds of requests in your office for men with lupus who are concerned about working? And what do you usually recommend for men as far as any workplace accommodations or considering their work because of lupus?
Yeah, that's a great question, and it's definitely highly individualized. I'll say at the first, I'd say from the physician side, usually the first things that I try to think about is which parts of this are reversible and maybe active inflammation, something that we're going to aggressively treat and get on top of, versus which parts are more structural and maybe things, like, some bad things can happen sometimes where maybe you lose mobility or you lose, something where we aren't going to be able to fix it with anti-inflammatory treatments. And I think that's one of the early decisions. I just bring that up because there are a number of things with lupus that are fairly treatable. So I think for people that want to, stay on the job and are worried about having to change what they do, if it's a new diagnosis, then usually the answer is that you're going to go for it for a little while with treatment. You might need some time off to sort of get treated and get better if you're fairly sick. But as far as longer term planning, it's probably it's probably hard to decide right off the bat, until you go at it for a while and see where you come out. But there are some things that can happen, like avascular necrosis happens sometimes, and that's where you can have part of a bone that gets sick and actually dies off, and so then sometimes people need joint replacement surgeries or may have some increased, troubles with mobility, and so there are things that can happen that can impact your work, especially if you have a job that's physically demanding. And so then in those cases, then sometimes accommodations are needed. But I'll say it's not the majority. So I think that's the good news, is that usually we can get people through. There's an unpredictability, but I'd say it's more common that you might need some days off during the year than that you would have to do a more permanent lifestyle modification. But again, this is all speaking in generalities, because it really depends on how severe lupus has been for you and what it's affecting. And as we all know, it can affect a lot of different things. So, but in general, in broad strokes, I guess that's how I'd answer that question, is that it's individual, and then there's there are a lot of ways you can get on top of it. It sometimes takes going through a couple medicines. I'll say that's where I'll end this one, is that it does take some patience on the part of both the patients and the physicians, unfortunately, because sometimes it takes a little while to find the medical program that really works for you and what is the best balance for you. And I'll say that in the field, it's a research area that I'm hopeful about, that I'm hoping we can find, better ways to understand which works for which person at what time, all those kind of questions. For those of you with lupus listening, you've been down this road, trying to find what's the optimal program for me. And then it changes sometimes, the disease changes, your body changes. And so there is a lot, there's a lot of this that goes on. So unfortunately it does take some patience, but yeah, definitely work with your physician around all of these issues.
Yeah, I think that's really great. That communication is so key. And yes, you're absolutely right. It does look different from person to person. It's kind of a moving target on, how a person's going to feel. So that patience and communication, that's some really great advice there. I do want to say too, I think it could be really helpful for a lot of people out there who maybe are getting started on treatment plans. And like you said, they're kind of having to try a couple of different options before they get the right fit. For men to connect with other men. And we have a really great men's virtual support group, which people can get enrolled in at lupus.org. So that might be another great place to just kind of bounce ideas off other men who find themselves in a similar situation, and be encouraged that, like you said, this can change over time. It doesn't always have to be permanent.
Yeah, and I think that's great. I've had male patients, say to me, I thought men don't get this, doc, and
right.
it's less common, but when I think, usually when someone says that to me, then I think about these things like, oh gosh, this probably feels fairly lonely, right? And that if you think that men don't get it at all, that, and I have actually referred people to this support group, and I think it's a great thing, because it is, you can sometimes feel alone, or you think, gosh, I'm not supposed to get this. I thought only women get this, and that's not true, so it can help to talk to other people that have been down this similar path.
Yeah, absolutely. Well, as we close up today, I have one last question. Do you have any advice that you give to men out there who think they might have lupus, or men who are living with lupus? Anything that you can impart today?
I think, we hit a number of important topics. I would say I'd probably, as a point of emphasis, do see the doctor, do get checked out. I'm having Y chromosome myself, and I'll admit that I'm myself not always the most likely to go to the doctor. And I think, this is, if you take a data-driven perspective about, what percentage of patients, how often men seek care versus women seek care, it's less for men. We have to be honest about that, men, that we don't seek care as much as we probably should. But lupus is dangerous, and it is one of these things where it's important to take care of yourself and to get out there, and that'll help you stay strong, keep doing the things you want to do, and so it is really important. I think probably the most important thing I would say, both if you're worried about whether you may have it or if you do have lupus, is to connect with the healthcare system, let your doc know your concerns. They'll check it out with you. If you already have lupus, obviously you're past that point, but then, definitely stay in touch. We always worry if our lupus patients are not in touch. Sometimes it's for a good reason that people are feeling great, but we don't want to be out of touch when someone's getting sick. So I think that's maybe what I close with in Men's Health Month, is that I think that's a challenge for all of us men, is to try to make sure we really keep up on the health side, to keep up with ourselves. So, and and that's particularly important in lupus.
Absolutely. Well, thank you so much. Thank you, Dr. Niewold, for your time today. This has really been an excellent discussion, and I'm so very pleased that we had the chance to really dive in on the topic of men with lupus with you.
Great. Thank you for having me.
For those of you listening in, to access more information about men and lupus, please find more information on our National Resource Center on Lupus by visiting lupus.org/resources. If you'd like to learn more about support groups for men, please visit lupus.org/support group. To listen to additional episodes of the Expert Series, you can visit lupus.org/the Expert Series, where you can also subscribe to get alerts when podcasts are released. And if you'd like to speak with one of our health education specialists, you can go to lupus.org/health educator or call 1-800-558-0121 extension 136. And finally, to connect with others with lupus from all over the world, I invite you to check out our online support community, Lupus Connect, where you can talk with others, find emotional support, and discuss practical insights for coping with the daily challenges of lupus. You can find the community at lupus.org/Lupus Connect. Thank you and have a wonderful day.